Okay, so we're going to get real today about type 1 diabetes, and I want you always to go and ask your endocrinologist before doing any of the things that I suggest for myself, but I just wanted to make you aware of certain things that are available to you in times of crisis, at least where I'm at. I live in North Carolina, and currently I'm having issues with the line of communication between Medtronic, my insurance, and my endocrinologist. So we're going to figure that out today. I have to do, that's part of my errands. But I wanted to tell you what I'm doing in preparation in case I don't have pump supplies. Okay, so first things first, make sure you have backup insulin. This is Levemir. It's a basal insulin. You have to go to your endocrinologist or your certified diabetes educator to learn how to dose this and what time to take it. I have talked to a diabetes educator about my own dosing because I have specific basal needs throughout the day. You dose pens with pen needle caps, and then you can also get this in a vial, which you will need to know how to use syringes. So make sure you ask your CDE or your endo about how to use syringes. I also have Novolog for corrections. Okay, use pen caps. I actually would have to pull. I learned how to pull with a syringe using this because I use such a small amount of Novolog when I do correct. Or, if I need to, this is Novolin R. It's regular insulin. It's a slower insulin. I actually use this for my meals right now, but I could also use it to correct my blood sugar in case of elevated blood sugar. You get this at Walmart. It's $24.99. I buy out of pocket currently. Most states you can buy Novolin R out of pocket without prescription, but you need to check. If you want this as a backup, talk to your endocrinologist, talk to your CDE. You can also get NPH, which is an intermediate acting insulin, which can be used as a basal insulin and was formerly used as a basal. The issue with that is you need to dose it correctly. And you have to eat on a schedule because it has a peak, unlike Levemir, Lantus, or Tresiba. Now, I also am currently not using Dexcom today because I ran out. If you've run out of your sensor, you need to test more often. I get a limited amount of strips every month, and so sometimes I run out. So what I can do, again, is you go to Walmart or your pharmacy, and you can get a backup meter. This is the Rely on Prime. I call these Am I Dying strips. They're not as accurate as my Contour Next meter. Then let me show you what it looks like. Let me throw it into the sink. Always comedy in my videos, I tell you what. But this meter was less than $20. And then you buy the strips. These are, you get 100 for less than $20. Then you have to buy a lancing device and lance it separately. Normally we tend to have that around. Another thing is, I know they keep getting taken down and you have to be wary, but there are pay it forward groups on Facebook. So you do what you gotta do, cover down, take care of each other. But in the light of an emergency, you should always have backup insulin of some form. Talk to your endocrinologist, talk to your CDE, ask them for the education that you need in order to survive, because this is our bodies, this is our disease, and if your endo tells you not to worry about the situation, you may need to look for a new endo. I actually had asked about our insulin and things like this, and I was told not to worry. That's why I have a new endo coming. Because now I'm in a situation where I need to know how to do this, and they didn't teach me. So I'd asked Dr. Facebook. Thank God for Dr. Facebook. So I'll be okay, but I want to make sure you're okay. So backup insulin, backup strips, make sure you know how to use it, because shit happens. And that is my little tidbit for the day. I'm going to go figure this out, talk to some people, and thankfully I'm grateful that I actually can straighten this out most likely. You have a great day.